We know high vaccination rates are critical to protecting our communities and hospital capacity while keeping our schools and businesses open and our economy running. Thank you to the over 10 million Ontarians who have already received both doses. 2 weeks ago, we announced another measure to increase vaccination rates and protect Ontarians by requiring proof of vaccination to access certain settings beginning September 22nd. Already, we are seeing the impact, with over 90,000 first doses administered in the week following our announcement to require proof of vaccination, an increase of 29% from the previous week. To ensure individuals, families, and business know what to expect, today we are sharing new materials and guidance to prepare them for these changes and help address any questions. And together with our health system partners, we are continuing our last mile strategy to reach even more Ontarians who have yet to receive their first or second dose. We are using every tool available to make it easier and more convenient to receive the vaccine and help address hesitancy. Physicians are calling their unvaccinated patients to answer their questions. Our GoVax bus continues to visit schools, malls, and community and sporting events, and over 550 vaccination clinics are underway or planned in or nearby elementary schools, high schools, and colleges and universities. We know some people may have questions about whether the vaccine is safe for youth and pregnant individuals, and whether one dose is good enough instead of two. I want to be very clear. All Health Canada approved vaccines are safe, effective, and significantly reduce your risk of serious illness from COVID-19. If you have questions, please reach out to your healthcare provider who can walk you through your specific situation and the benefits of getting vaccinated. So please, if you haven't received your first or second dose, sign up today. And in advance of September 22nd, I encourage everyone to print or download your vaccination receipt from the provincial booking portal as soon as possible. Thank you, and I will now hand it over to Minister Rashid.
Thank you, Minister Elliott, and good afternoon, everyone. I'm here alongside Minister Elliott and Dr. Moore today to share an update on the technology we are developing to support the Ministry of Health's public health measures. Right now, most people across the province can download and print their vaccine certificates from ontario.ca. You can choose to save this certificate on your phone or print a copy and carry it with you. Next Wednesday, September 22nd, these vaccine certificates, along with a piece of valid government-issued ID, will be what you show at the door when asked to verify that you have been vaccinated, where it is required. For Phase 2, which starts October 22nd, I'm pleased to report that we are on track to release both our enhanced vaccine certificate with a QR code and the QR code verification app for businesses. When released, these work will follow as follows. For people, your vaccine certificate will have a QR code. That is your vaccination credential that you will provide when needed. For businesses, we are releasing a free app that you can download from Apple's App Store or the Google Play App Store onto a smartphone and quickly and easily scan QR codes, which will tell you if a person can enter your establishment. We have chosen this approach for two reasons. First, a QR code that is your enhanced vaccine certificate will make it easier, more secure, and convenient to show that you have been vaccinated when you need to. And second, our Made in Ontario app will make it quicker and easier for businesses to confirm that a person's vaccine certificate is valid. I want to be very clear. On October 22nd, you will have the choice to download the QR code enhanced vaccine certificate, or you can continue to use the print version. And to make it easy for businesses, we will be releasing the free app to quickly scan and verify those QR codes. Your information will never be stored on our app, and the app will only show the minimum amount of information needed to confirm that an individual has been fully vaccinated. Like other leading digital governments, we are also building the app and plan to release the app as open source software. It is transparent tech that can be continuously improved. We have some of the most talented developers and designers in Ontario working on this app. My team at the Ontario Digital Service is building the app in-house, taking advice from the private sector and other jurisdictions to help us get this right, to protect your data and privacy from the start. We also know how important it is to support businesses with the tools and information they need to adjust to these new requirements. We will also provide guidance for businesses on the app in advance of its launch. I'm proud of the part that our digital team is playing to help keep people safe and our province open. And I look forward to regularly sharing updates on this important work with you. Thank you, and I will now turn things over to Dr. Moore.
Thank you, Minister Elliott and Minister Rashid, and good afternoon. As we continue to learn to live with COVID-19, the data is telling us that the most important step to protect ourselves and each other is to get fully vaccinated. The numbers are telling the story. Those who are unvaccinated are 24 times more likely to be in a hospital than those that are fully vaccinated. They are 43 times more likely to be a patient in intensive care settings compared to those that are fully vaccinated. Vaccines are safe, they're effective, they work to protect Ontarians. Ontario is following the evidence when it comes to third doses of the COVID-19 vaccine, as well as following the recommendations from the National Advisory Committee on Immunization. A complete 2-dose COVID-19 vaccine series provides strong protection against COVID-19 infection and severe outcomes, including against the Delta variant in the general population. However, for some populations, a third dose may be required to provide sufficient protection because of a waning immune response to vaccines and increased risk of COVID-19 infection. So today we are expanding the eligibility for additional vulnerable populations, including those undergoing active treatment for solid tumors, those who are in receipt of chimeric antigen receptor, so CAR T cells, individuals with severe or moderate primary immunodeficiencies, individuals receiving active treatment for significantly immunosuppressive conditions, and individuals with stage 3 or advanced untreated HIV infection, and those with acquired immunodeficiency syndrome. The locations and timing for third doses will vary by public health unit and high-risk population based on local planning and considerations. Immunocompromised individuals with one of the eligible conditions will be contacted by their healthcare provider to confirm their eligibility and provide them with a referral to a vaccine delivery channel, such as a hospital, a specialized clinic, pharmacy, or primary care provider. Please be patient, as it may take time for healthcare providers to reach out to all the eligible individuals. The months ahead will be challenging. COVID-19 is not going away, and the risk poses will continue throughout the fall and winter. We've seen how the virus can change and it can spread, and we need to be humble, resilient, and adaptable. We will continue to take cautious and reasonable actions based on the data and evidence to ensure there is a strong chain of protection for all Ontarians. But we know that vaccination is the key to protecting ourselves and especially our most vulnerable. Again, Please roll up your sleeve and get the shot. Please get vaccinated. Thank you.